Thank you, Christine. Good afternoon, everyone. I'm happy to report that we have no new cases of COVID today, and Dr. Strang will give us an update.
Thank you, Premier. Good afternoon, everybody. Before I talk about COVID, I just want to take a moment to talk about the Irving Shipyard situation I'm sure everybody's aware of. Over the last 4 months, I've approved plans that have allowed essential workers to come into this province to do work that requires specialized skills. I've worked with each of those companies to draft very specific plans that follow public health protocols and ensure we have the necessary COVID safety. In fact, I've said no to a number of plans. I've even turned around a plane load of workers who were in the air about to land in Nova Scotia because I couldn't approve the plan because it didn't provide the right level of COVID safety. We then worked with the company to develop a proper protocol, and the work has moved ahead and it's gone very well. So there are cases where specialized skills are required, and as long as proper public health protocol is developed in these cases, I will approve those. We do need to keep the economy going. I looked at the Irving situation with the same lens, but after a number of concerns were raised, I took a second look. And I realized I should not have approved the plan as it was. Even though safety requirements were part of my approval, the meetings could have been done virtually. Upon return, the individuals involved can isolate at home and still manage to work. That's why I revoked my initial exception and reversed that decision. The executives are now isolating at home, and Irving has been fully cooperative. I will continue to make exceptions for specialized skilled labor and essential services. These will be dealt with on a case-by-case basis, and I want Nova Scotians to understand that the lens that I put on this is appropriate protection of your health and safety, and I will only approve plans if the necessary COVID safety protocols are in place. I'll now provide an update on cases in the last few days. Our last briefing was on Monday. Since then, we had no new cases on Tuesday, and a new case yesterday, and again, no new cases today. Yesterday's new case is a Nova Scotian who works in the movement of people and essential goods, and that individual had traveled outside of Nova Scotia before becoming ill, and that was the source of, they traveled outside of Canada, and that was the source of their exposure outside of the country. So with one new, we also have a new recovery reported today, so we currently have 4 active cases of COVID-19 in Nova Scotia. As with the cases that we reported last week, the 2 cases, the one from the weekend and the one from yesterday, our contact tracing has found minimal numbers of people identified as close contacts, so that's good news for all of us. To date, in Nova Scotia, we now have had 1,066 cases of COVID-19. 56,227 people have been tested with negative results. We've had 63 deaths. We continue to have no long-term care homes in Nova Scotia with active COVID-19, which is good news. And again, as of Tuesday, the COVID-19 outbreak in Northwood, we're able to declare that over. Yesterday, our microbiology laboratory at the QE2 Health Sciences Center tested 398 individuals. So I want to still encourage anybody who feels unwell to do the 811 online assessment, and if you're directed for testing, and go forward and get tested. It's important that we still have a low threshold or testing anybody who might have symptoms suggestive of COVID, and we continue to have access to testing through 811. We have testing sites open around the province, and we have lots of capacity in our laboratory. I want to move on to talk about masks. There's a lot of discussion about masks, a topic that a lot of people have an interest in. Continue to look at our approach based on the evidence available. We continue to have conversations amongst the chief medical officers of health at a national level. In fact, we have a call this afternoon, and we're having masks as part of the agenda. I want to thank Nova Scotians who are following the recommendation from Public Health, which is a strong recommendation to wear a non-medical mask if you're in situations when you're around other people and the physical distancing cannot be maintained, or you're not certain that it can be maintained. So those are often situations if you're in a store, if you're in an elevator, if you're on a bus, even if you're in an outdoor gathering with lots of people around. Those are all circumstances that we strongly recommend that people have a mask. So we encourage everybody to always have a mask with them, and if necessary, you can put on the mask. We need to make it a habit, as I said, to always have a mask with us. So every time we go out the door, we should, like we grab our wallet and our car keys or our purse, we should have a mask with us and wear it in those environments, like when we go in, before we enter stores, before we get on the bus, put on a mask, because we don't, in those environments where we can't be guaranteed that we're going to be able to keep 6 feet apart from each other. It's a way we keep each other safe by each of us wearing a mask. It's one piece of masking is one piece of our efforts around controlling the spread of COVID-19. It's important that people understand that masks are part of the package that I've been talking about. So we need to think about if we're not feeling well, we need to stay home and not go out and about. We need to maintain the distance of 6 feet or more wherever possible, but in circumstances where we can't be assured of that, everybody wearing a non-medical mask. We need to continue to practice, good frequent hand washing, cough etiquette, coughing into the sleeve, into the crook of your elbow, frequent cleaning of surfaces where hands go. All those pieces together, as I've said before, those are the tools, that collective package of tools that we have. If each of us does those well, we minimize the chance of, even when we get COVID-19 in the province, we minimize the chance of it being able to spread broadly in our communities. So it's everybody doing those personal protective measures, and in the health system and public health, maintaining the capacity for easy access to testing, a low threshold for testing, all the capacities, and then having rapid public health follow-up of all the cases. That is what we need to continue to focus on moving forward. Those are the tools we have to control COVID-19. Premier.
Thank you, Dr. Strang. On behalf of all Nova Scotians, I want to tell you how much I appreciate the hard work that you've been doing over the last 4 months, and I know it has not been easy 4 months as we work to protect the health of Nova Scotians, and you review multiple plans to come in to open up our economy, get us back on footing. But I want to tell you that I am proud to sit here with you each and every day, and I'm proud to be here today as we continue to do what we think is right to protect the health and safety of Nova Scotians. So thank you.
I appreciate that. Thank you very much.
Happy to take any questions.
Reminder, one question and one follow-up for those on the line in the amount of time that we have for today. First question will go to All Nova Scotia's Lindsay Armstrong.
Thank you. Dr. Strang, how many business exceptions have you approved since the pandemic started, and are you reconsidering any of those other ones now?
So I don't have a number. You have to understand the volume of things that come into my office. We've had to bring in an extra person just to try to manage these. We haven't set up a system that allows us to, count each one of them. You have to know that a lot of those we say no to. Certainly, if concerns are raised about any plan, I would go back and review that plan. I don't have any plans to go back and review plans unless concerns are raised about them.
Go ahead with your follow-up, Lindsay.
Yeah, so on that point, I understand the Irving exception was made with very tight restrictions, as you said. Were the proper rules followed in that case? And what changed in your mind yesterday since you revoked the exception?
As I said, when we looked at that, went back and reviewed the plans, understanding that we really need to focus on people who there's essential work that can only be done by bringing people in from outside of the province or outside of the Atlantic bubble now or outside of the country. Went back and looked really the work that could have been done both on the trips to the U.S. could have been done virtually, and they can do the work that's necessary for them to do once they're back, by staying and doing it at home, staying isolated. So when we review when the concerns were raised, legitimate concerns were brought to my attention. I went back and reviewed the plan, had a conversation with Irving, very cooperative, and we moved forward.
Next question will go to CBC's Mike Gorman.
Thanks, Dr. Strang. I'm just hoping to follow up on Lindsay there, whether or not you can confirm that although you changed your mind on the Irving exception, that they followed the rules that you had initially laid out for them. And as you say, as you review these plans, you're doing it through a case-by-case lens based on security What was it you saw the second time that you perhaps didn't see the first time with that Irving proposal?
So concerns were brought that maybe individuals weren't able to maintain the safety protocols that were in place. So when we reviewed that, we didn't get into details of if they were or were not doing those safety protocols. But when I really looked at it, I said we don't even need to have those protocols in the first place. We shouldn't have done that. Shouldn't have put those in the first place. That we need to just isolate them and keep them at home for 14 days. They can still do their work. And then we don't have to run into the issue about are they or are they not able to comply with requirements in the workplace.
Mike, go ahead with your follow-up.
You mentioned that what prompts you to review these is concerns that reach your office. Obviously, you got concerns from workers at the shipyard. I've heard concerns from workers at another dockyard about people who are being brought in to work there. In light of the fact that you need a concern brought to you, what responsibility does an employer with an exception have to make everybody on the job site aware of the fact that the exception has been approved and that there are people who are either coming or going who are subject to that exception?
So that's the responsibility of the workplace. I know I think I know the other example you're talking about where questions were raised to me, and I actually went back and we actually the people who brought the concerns forward, we actually explained the protocols that had been put in place and the steps that were being taken, and that satisfied the person's concerns. So yes, as we put these in place, it's not my job to do the communications on an individual work site, but the expectation would be that the company doing that would have the appropriate communication so people are aware and they can understand what protocols are being put in place to keep them safe on the work site.
Next question will go to Natasha Pace with CTV.
Thank you. Premier, last night a vehicle compliance officer working alone at the gatehouse in Amherst at the Nova Scotia-New Brunswick border was assaulted. The union says they've been fighting for better protective equipment and training for over 2 years, and that their officers right now only carry a radio. I'm wondering if now that there was such a serious incident where a worker was grabbed by the throat and injured, whether or not you're going to work with them to provide more assistance and more training for workers at the border.
So obviously that incident is concerning. Law enforcement are involved. My understanding that it's working its way through the system. We appreciate the work that's been happening at our border. These have been information pickets that we have set up, but if at any time we had felt it required law enforcement or the training of a law enforcement officer there, we would have put our RCMP or municipal forces on there. But I do want to thank the tremendous work that has been happening by the members of the public service at every one of our entry points, not only at the land border but here at our airport. And I look forward to continuing to work with them as we not only continue to keep Nova Scotians safe, but as we continue to grow our economy.
Natasha, go ahead with your follow-up.
Thank you. I understand that you appreciate the work they're doing, but the union is concerned about the safety of their members. They say that there's been 3 or 4 incidents in the last few months where vehicle compliance workers were injured by the public. We have one last night. I'm just wondering whether or not you can commit to perhaps talking with the union, providing more training, providing protective equipment that they say workers need.
So I would say to you, you just described to me 3 cases that I don't know anything about. To me, the union has looked at every opportunity to complain and look to divide. This union was also out about saying healthcare workers are not receiving the bonus. It's actually false and inaccurate. If there is an issue, though, about the safety of someone at our border, we take it seriously. It's why law enforcement are on. It's why we continue to follow the protocols that we put in place around the information picket, why we will continue to do so, and why we will work with our partners. But I will not, allow some people to try to divide our province as we continue to work our way through dealing with COVID and reopen our economy. It is not in our collective best interest to continue each and every time to hash over issues that some union or someone else may have had with our government 2 years ago. I get it. But the reality of this isn't about them. This is about Nova Scotians and all of us in this together, and we will ensure that if the law enforcement agency is required at that border, they'll be at that border. But let's continue to move forward.
Next question will go to Alicia Draus with Global.
thank you. I just want to go back to the questions around Irving. If all your decisions are made based on scientific evidence, and you were aware that these meetings and their work could have been done virtually in the first place, I'm just again wondering why you decided to grant this exception if they could have done it virtually from the get-go.
So Irving approached me, and they had rationale of why they felt it was necessary to have those meetings in person. That's why at the time I said yes, but put in the appropriate protocols. But on review, because of some concerns, especially about some of the challenges perhaps of adhering to those protocols, I reversed that decision. I'm not going to get everything I do of the hundreds of decisions I make every week on this. I will acknowledge that I may not get everything exactly right, but I'm always happy to go back and learn from my mistakes and certainly be looking more intensely about how we make sure that we focus only on essential travel into the province where there's no other alternative.
Go ahead with your follow-up, Alicia.
Thank you. This one's for the Premier. With less than 2 months until school potentially starts back, there's a lot of anxiety from both parents and staff about not knowing what's going to happen. So can you give some kind of indication about what the province is considering for any return to school come September?
Yeah, the minister is working with our partners in education to lay out what a plan will look like coming for September. Their work is ongoing. That will be communicated out in the coming weeks to families and to teachers and to our broader community.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. This is a question for the Premier. The Irving Shipyard said in a news release yesterday, after the quarantine exemption was revoked, that what they call the changing and very restrictive nature of the response to the pandemic makes it difficult for them to plan ahead. I'm just wondering, have you been in contact with the Irvings to discuss their concerns?
I spoke to Mr. Irving last night. I had not talked to him in a long time. I can't exactly, to be honest with you, tell you the last time I would have spoke to him, but I did speak to him last night. I did not know about the exemption. Obviously, that wouldn't be involved with me. That would be the issue through public health. Listen, my communication is to all of those in this economy. This has been a very difficult 4 months. We have been dealing with a whole host of issues unrelated to the pandemic. On top of that, we have actually closed businesses down. There are businesses around where I'm sitting who've invested their own money, who've worked hard, who've put a lifetime of work into those businesses, and we closed them 100%. There are others, though, who've been able to operate as long as they follow the public health protocols. And that was what my message was and will continue to be, that we will follow the public health protocols as we try to continue to move our economy forward and get people moving about our province again.
Go ahead with your follow-up, John.
Thank you. I guess this would be for Dr. Strang, and this is a question that I'm relaying from a colleague who's doing a story on the restrictions in long-term care facilities. Right now, those restrictions are still fairly strict. There's one 30-minute outdoor visit per week, and most residents are still confined to their rooms for most of the day. We've spoken to family members who have said their loved ones are having a very difficult time. So, I mean, the question comes as whether we should expect any changes soon in the restrictions put in place.
Yeah, I was involved in a discussion this morning about this. Absolutely, we recognize that we need to open things up in allowing more opportunities for residents within the facility, as well as for more opportunities for visitation, recognizing that it's a very high-risk setting, so we have to do things thoughtfully and carefully. So, but there's work going on to relax some of those guidelines, and we're going to be moving in the very near future and bringing that forward publicly.
Next question will go to Olivier Lefebvre with Radio Canada.
Merci. My question is for the Premier. Going back on the mask, are you now wearing a mask, Premier, when you're out in public at stores?
So I wear one when I go into a confined building, a restaurant. If I'm walking from where I stay, I'm in the city to my office, I don't. I would walk the street without that mask. I've been out to dinner a couple of times this week. I wore a mask into that environment. So if I'm walking, I on the general street, I don't, but I do if I'm going into someone's place of work or confined space.
Go ahead with your follow-up, Olivier.
My follow-up would be for Dr. Strang. You said earlier in the update that we need to make it an habit to leave the house with a mask. You're having a conversation this afternoon with your federal counterpart. I'm wondering if you're getting any closer to make masks mandatory in closed public space.
So, I mean, we're looking at certainly we have been looking and continue to look at a number of things from a legal perspective, from a logistical perspective about if we did go, decide to have masks mandatory in certain settings, what are the things that we have to make sure we have in place to allow that to happen effectively. So we no final decision to be made. Right now we're sticking with our strong recommendation, but we continue to work having things in place that if we need to go down the road of mandatory, we are ready to do that.
Next question will go to Chris Halaf with News 95.7.
Thank you very much. This question is for the Premier. The Atlantic Provinces Trucking Association has been raising concerns about how delays at the border are impacting the commercial trucking industry. They've suggested some ideas to the province, like a separate lane for commercial vehicles. But the President says despite a conversation earlier this week with the province, it doesn't seem like the province is listening. Now, those are his words. Does the province have any plans to make changes at the border when it comes to truckers?
So there was obviously a major congestion on the weekend. We had 10,000 people trying to come across our border over the weekend. We were working our way through that. Early on, we had a separate lane that actually trucks were using and essential service workers. But obviously when that many cars converged on the weekend, people started using both lanes, which caused and created the issue that you're describing. And what we have made a movement where Atlantic Canadian plates are moving through the border really quickly. Those that do not have Atlantic Canadian plates or non-essential service works are being asked for the information that's required. Where are you going? Where are you staying? What's the phone number that we can contact you? And it's been my understanding that in the last second half of this week, really from Tuesday on, that traffic has been moving well in the direction from New Brunswick to Nova Scotia. I'm not sure what's happening in the opposite direction.
Chris, do you have a follow-up?
I do, yes. This one is for Dr. Strang. Now, the Atlantic bubble has been in effect for nearly a week now, and there was talk about potentially opening up the province to the rest of the country at some point this summer, later this summer perhaps. But with recent advisories from the NSHA about potential exposures on flights from Toronto to Halifax, does that change things for the province?
No, I think those don't. I mean, the situation remains that we know as we open up, we're going to we always have the possibility of COVID coming into the province, whether we have the Atlantic bubble or not. It'll continue to work with the Premier, and we need to look at the epidemiology of what we're seeing in other parts of the country, so we can do that safely. We don't want to have unnecessary restrictions at our border or requirements at the border, but we also have to understand they're there for a purpose. So we need to make sure that when we take them down, we're in a place where we can do that safely. We're always going to have circumstances where we have to do things like a notification on a plane, or notification as we've done previously in a grocery store, or that's always going to be part of what we have to do around COVID or other infectious diseases when we can't contact individuals directly. That public notification, just because we had to do that in a circumstance with the plane, doesn't mean that the overall risk has changed in any way.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, I was actually going to ask about planes to revisit that. So you've addressed some of this, and it just seems to me that the public has been quite rattled and concerned for the last positive cases, especially the ones on airplanes. And I asked you about this last time we spoke, but then you said that epidemiology doesn't suggest increased risk. Dr. Fauci down in the U.S. says he won't get on a plane. I wonder if you would.
So I'd be, if I needed to get on a plane to fly, I mean, I think I'd make sure I follow, I'd be wearing a mask, making sure very careful with my hand washing. If we look at actually the epidemiology of COVID-19, and we have a lot of experience now, that actually the planes, actually flying on a plane is not being actually shown to be a significant driver of transmission of this disease. There's lots of other circumstances, but like anything else, there's some level of risk that people need to take the appropriate steps to minimize that risk.
Tim, do you have a follow-up?
Yeah, are you doing any or plan to do any tracking in terms of increased travel to Nova Scotia from the U.S., especially as the school year approaches?
Well, we continue to look at the numbers are coming in across our border, whether it's at the land border or through the airport. We're monitoring those numbers and one of the pieces of information we're collecting is where people are coming from.
Next question will go to Steve McKinley with the Toronto Star.
Hi, sorry about that. I have to get myself off mute. The question is for Dr. Strang. A lot of provinces are talking about making race-based data available for COVID tracking, and I'm wondering if you have had conversations about that, if you've got any plans to make that kind of data available, and why or why not.
So we're involved both at a provincial level, not just related to COVID, about how we could get have a racial or cultural identifier with all our health data. So there's discussions underway on that. We're also involved in discussions at a national level, led by the federal government, Public Health Agency of Canada, Stats Canada, about how we might actually do this collectively, specifically related to COVID. So we're not going to do this on our own. We're doing it as part of some federal, provincial collaborative discussions.
Steve, do you have a follow-up?
Yeah. Has anybody set out a kind of a timeline for when you'd like this to happen?
So there's no firm timelines that I'm aware of. You have to understand that there's a number of challenges here. One of the first challenges is you have to get people to agree to have a racial identifier assigned to the data that we collect. So there's a lot of work we have to do with our local communities, and that's been ongoing work for a number of years. That I've been as part of the Department of Health and Wellness, engaging our African Nova Scotian communities, for example, around getting their consent to have a racial identifier attached to their health card number.
And that's all the reporters on the line today with questions. Go ahead, Premier.
Thank you. Before I read my final, there was a question about the U.S. border. I think it's important that all Nova Scotians and Canadians understand that border is closed. There are very strict restrictions on who gets across that border. Of course, any Canadian who is outside of our country, whether it's the U.S. border in Europe with a Canadian passport, has access back into their own country, and they need to come home and self-isolate for the 14 days. There are others who get in based on work restrictions, in and out. At the same time, you would know that a student visa is one of those that would allow someone to cross the border, but they must always follow the self-isolation programs that are there in respective provinces. But the U.S. border is closed, other than to those in the U.S. who are Canadian citizens or who have specific reason to be in this country. It seems to be lost on people that border is actually closed. At least till July 21st, and I know there's a lot of concerns on behalf of Canadians who will continue to encourage the national government to look seriously at extending that closure. We are heading into our second weekend of the Atlantic bubble, and if it's anything like the first, family and friends will continue to be reunited. And it is my hope that visitors will continue to keep rediscovering Nova Scotia. I encourage all Nova Scotians to get out and enjoy our province, eat in a restaurant, shop at our local stores and markets, visit our parks and beaches, think local, buy local, and support local. Our businesses need us, and we need them to get our economy moving again and help us gain the confidence to learn to live with COVID. Of course, we'll have to follow public health protocols. Keep your distance, wash your hands, Wear a mask when you can't distance, especially inside, or anytime you want. And with all of that, let's not forget who we are. Let's be open, let's be welcoming, and above all, let's be kind. There are those out there who thrive on the negative, who misinform to suit their own purposes, and who distort the facts to divide us. Let's not let that happen. We have worked too hard together for the last 4 months. It's not always been perfect, and we've made mistakes along the way, but we've listened and we would fix them if it's pointed out. And I want to thank all Nova Scotians for everything you've done in the last 4 months. We would not be here today without your hard work and sacrifice. So let's not stop now. We are in this together. Have a great weekend, stay positive, and stay safe.